You're good to go.
Hi everyone, thank you all for making it out today for our second presentation. We are really excited to share with all of you the progress we've made. So to begin, my name is Dahlia,
And my name is Nasser.
and we are co-founders of the Health Education Resource Database. We are a community that's dedicated to bridging the gap in healthcare. On our social media, you'll oftentimes hear or see us refer to ourselves as HERD. That's HERD. Health Education Research Database can be a mouthful. So if anytime you have questions about us, or even throughout this presentation, you are more than welcome to refer to us as HERD as well. So HERD was created in order to address an issue that we saw in the current healthcare system. And what the co-founders of HERD observed is that currently, as is, the healthcare system is really only catered to serving the majority. Now, we felt that this becomes a problem. BIPOC community, these members are not able to reap those same exact healthcare benefits. And the problem with that is it creates mistrust in the overall healthcare system, as well as leading to an increase in poor health outcomes among these BIPOC community members. So our solution to addressing that big problem is creating health education videos made specifically, really catered towards our BIPOC community. And what we want these videos to address, first off, is saving time for clinicians, especially within appointment times. So we want to save these time for clinicians during and after patient appointments. And we felt that really connects for educating our community members. So part of saving that clinician time is community members become educated on their own health concerns, and that way they'll already be educated going into their appointments. But also, even if they're not going in to see their doctor, we can still educate our community members by using layman's terms on relevant topics to explain these complex ideas. And lastly, and most importantly, I would argue, is sharing health information that is backed by science, that's factual. And so all of our videos would be thoroughly researched using the most current medical and scientific literature. So, how we want to create these health education videos is by publishing them on YouTube. Um, After publishing on YouTube, we will actually inform the masses. So, we are on Twitter, but we're focusing on just using Instagram and Facebook as our external social media platforms away from YouTube. And we will let people know when we created a new video, and then just be more interactive with their audience is on these social media platforms to kind of have them move over to our YouTube channel and be able to watch our videos. And lastly, we also want to reach across the table. Herd's idea isn't so unique in the terms of where they're going to be creating resources on health education. There's actually other people who are doing the same thing, who are very passionate about the same issues Herd is. And they are just creating resources in an alternate way that Herd is not. However, we just want to be part of that collective team. So we want to create or include alternative resources that are also talking about the health issues that HERD is, especially for our community members. We want them to, really encourage them to investigate and do their own research on the health issues that they're most interested about, but we don't want to gatekeep it. So we intend on including alternative resources that other people are working on to also educate the BIPOC community. And in terms of economics of herd, we really anticipate there being these two models. So first off is our free model. So these free videos will be made by the co-founders of Herd, and they will really be more about non-specialized health concerns. And so we foresee these being ideas like how to access health insurance, how to apply for it, and how to prepare for your doctor's appointments, just to name a few examples. And we're actually really excited about the trajectory of our free model because we're actually partnering up with an up and coming app. It's called the XB app. And we're just really excited. They have a health and wellness section, and they reached out to us, and we're collaborating together. And our videos, our health education videos, will actually be featured on their app. I'm really excited because that's just a really good way of us actually being presented and reaching out to members of the BIPOC community. But then moving over to our more subscription-based model, we're calling this our tier list. So we're going to have 3 different tiers, and we're actually going to be partnering up with clinics. So these clinics would subscribe to these different tiers. So each tier will have a certain base price that, depending on what the clinic subscribes to, they will pay annually. So we are starting off with our 3 tiers. We have our basic plan, which will just be plain specialized health videos, nothing specifically tailored to that health clinic. However, if a clinic does want some more tailored, catered health education videos, that's when we move into tier 2 and tier 3. So really the biggest difference between tier 2 and tier 3 is just the amount of customizable videos. With tier 2, we anticipate creating 3 custom videos specifically tailored to that clinic. And what that would look like is actually interviewing the clinicians that work in their office. That way, when patients have access to that clinic's health education videos, there's already an established trustworthy relationship between the clinician and the patient because they already know who they're seeing, only further increasing trusting that information that clinician is sharing with them. And as well, they'll have access to that basic plan. So with tier 3, we just added in an additional 2 customizable videos. So in terms of sustainability for Herd, how we're anticipate getting our revenue really is going to come from subscriptions to our YouTube channel and insurance. One of the things to mention is with that tier list, we're currently working on determining how we can get an insurance company to cover a patient, almost like billing them for a visit, billing them for watching one of our health education videos through their clinic that is subscribed to us. So with YouTube specifically, we want to get our revenue from YouTube ads. And then with our social media, by connecting our YouTube to our social media, we can also connect with social media sponsorships to help continue funding the business and ultimately grants as well. So this is something we created to kind of visualize how a patient whose clinic is subscribed to our tier model would have access to the health education videos from that clinic. And so a lot of patients get a printed version of their after visit summary, but they're also available on like a My Chart account. And so really how a patient would have access to the health education videos is through a QR code that's specifically tailored to that patient, and it'll appear in their after visit summary that they can just scan with a smartphone. And we're also in the talks of perhaps including a URL so for patients who don't have access to a camera with a or a smartphone with a camera will still be able to access these health education videos.
There are over 70,000 searches on Google every minute, of which 7% are health related. That works out to about 300 million searches a day, and this information was discovered prior to the pandemic in 2019. So this number is only expected to grow over the coming years. And if you do the math, it turns out to about 5 billion searches a year, or per day, forgive me. So if you look at our market validation here, you can see that about 5 billion searches a day are done worldwide on Google. And that's a rough estimate. So it could be substantially more for all we know. And then if you look here, there's about 300 million health related searches if you just do that math between 7% and 7 billion. Using our calculations, we found that about 30.2 million people, or about 10.8 of the available market, is what we could be targeting with our product. And that is inclusive of the BIPOC community. Just a quick shout out to the health and wellness market. There's about $1.5 trillion worldwide estimated to be in the health and wellness market. So that's a staggering number. Here are some competitors that we've lined up here, including YouTube, the CDC, WebMD, Mayo Clinic, Medline Plus, and Herd. You can see that we have a couple of different adjectives to describe what we could be providing. Trusted, high quality, cultural relevance, ease of use, accessible, customizability, and rapport. And as you can see, herd means, and we're headed towards the path of checking all of those boxes. For traction, you can see our onset on September 6, 2021. That was the day the co-founders finalized and signed the Constitution and bylaws. On November 12th, 2021, we did the MIT hackathon, where we put our idea to the test and got valuable feedback from the community. On December 12th, 2021, we did our first pitch in our efforts to try to recruit new members to our team. On May 16th, 2022, we had the opportunity to join the Thai Oregon Excel Bootcamp. And there we had opportunities to make connections with a vast majority of people and have been very fortunate to actually come across JLo, who is one of the owners of XB, the app that we're partnering up with. And then July 2nd and 3rd, which is today and tomorrow, is when we're doing our second pitch in order to share our progress and recruit new members. July 16th and 17th of 2022 are our filming days, are the days that we plan on actually creating this free content in regards to how to get ready for your doctor's visit, how insurance works, stuff like that. And then in August and September of this year, we plan on releasing those first health education videos. So for future expansion, we're actually trying to recruit a CFO or a chief financial officer, somebody who has a understanding of business and would be able to help us at least formulate a business plan and just come up with new ideas for the subscription model and stuff like that. We're also looking for editors and social media experts, people who actually majored in or just have a lot of experience with editing content like the videos, as well as working with social media. We also plan to create a website, our home base, so that we can display all of our content and have an easy to go link, highly accessible link that people can just go to without having to search through multiple social media websites or YouTube to find our content. And last but not least, we also plan on building partnerships with local community health centers and clinics. And that's something that we are currently underway doing. As you can see here, we have the amazing, beautiful Dahlia, who is our president and co-founder. We have the amazing and beautiful Doris, who is our secretary and co-founder. And then we have me, who is the vice president. If you have any questions, feel free to ask us now. You can post those in the chat. You could also send us a message on our Instagram or Facebook, and we usually get back to people within a day, so about 24 hours. And those are our resources. Do you have any questions? There are no questions, no worries. This video will be put on YouTube as a VOD, as well as chopped up and placed throughout Instagram and our Facebook. So no worries if there aren't any questions at this time. If you're interested in signing up, feel free to reach out to us via social media. If you follow us at Getting Heard on Instagram or on Facebook, or just here on Google as well, you can leave a comment saying that you're interested, and we'll get right back to you as soon as we can. If there are no questions, we'll go ahead and end the presentation. And we appreciate you guys coming out.